Hello guys, welcome today. In this video, we are going to talk about a condition known as ophthalmia neonatarum. This condition is also known as neonatal conjunctivitis. It simply means an infection affecting the eyes of the baby, as this image here shows. Ophthalmia neonatarum is an infectious condition primarily caused by bacteria. It can as well be caused by viruses, but in most cases it is caused by bacteria. It affects newborn babies, most especially from 24 hours to 30 days of their life. Okay, what are the risk factors or what are the predisposing factors of this condition? During antenatal, most women or some women contact an infection known as chlamydia or other genital infection. This infection, if not treated during antenatal or if not managed properly and premature rupture of membrane occurs, the infection can travel up and contaminate the baby in utero, leading to this condition. The condition does not really start in utero, but after the baby has been delivered. During childbirth, as the baby begins to descend and pass through the birth canal, it will rub its face on the vaginal wall, thereby coming in contact with the microorganism. So after 24 hours, the signs begin to manifest. If the infection climbs up or migrates into the womb while the baby is still in the womb or uterus, it can as well be ingested by the baby. And after 24 hours, following childbirth, the signs may begin to manifest. So what are the signs of ophthalmia neonatarum? Most times when babies are discharged from the hospital, this condition manifests. So what are the signs as a mother that you can see to say, okay, my baby is having ophthalmia neonatarum? Number one obvious sign is discharge from the eyes. Number two is redness of the eyes. Number three is inflammation of the eyelids. The baby forcefully closes their eyes, or because of the inflammation, their eyes is fluffy and closed. Another sign is fever. When it migrates to fever, it is becoming more serious. Meanwhile, no level of this disorder should be neglected. Okay, so what are the managements? What can you do primarily for this baby? We use eye ointment. That is a topical method of drug administration. We use topical eye ointment, antibiotics to apply on the eyes. Also, we use certain injectables in major cases where fever might have manifested. We use also oral suspension or syrup, antibiotics, and also antipyretics to calm down the fever. So what are the possible complications of this condition if not managed? Remember, when you see this condition outside the hospital, that is, you have been discharged as a mother and you get to your house and you see this condition, please report to the hospital as soon as possible. Do not apply anything on your own because proper examination must be carried out, like taking swab sample to check for the primary cause of the condition. Chlamydia is mostly the cause, but most times or sometimes we have gonococcal related cause, even though all of them are bacteria related. Another thing you should do is make sure you keep your baby clean. You can as well wipe with clean water and cotton bud. Just clean the eyes off and report to the hospital as soon as possible. So what are the complications of this disorder if not managed? It can cause retinopathy. That is a complication, one of the complications. It can cause blindness. It can as well cause permanent damage of the eye, blurred vision. The baby may have a certain level of visual disturbances if not managed properly, and also death may occur if it migrates to severe sepsis. Thank you very much.